Uh, Dr. Shockley, this is a pain management EHR software that I'm going to demonstrate to you with the general overview of the whole system as well. Now, the company name is Bismatics. The product is PrognoCIS. We have been in business for 20 years now. This is a web-based system hosted through Amazon Web Services. So every employee of yours will be able to have their own login and password. And based on the privileges that they have been provided, they will be able to do the respective functionalities in the system. With that said, let me quickly log on to one of my, I think I'm logged on to one of my demo databases here, but let me show that to you how to log in. The way it would be that it will be a URL that your staff would click on, and I'm going to log in as a provider right now. So as soon as I log in, I can see my schedule in a manner that I have customized for myself right now. So I can see the patient, the reason for the visit status and all. So I like it very simple, straightforward in this fashion. But one of the employees may say, you know what, I would like to see their date of birth next to them. I may want to see who is the referring provider for this doctor, or maybe their insurance information. So this is extremely customizable. All I have to do is click on this manage columns, and I will be able to go and add the respective information that I would like to have it on my schedule there. So my home page. So let me go and add a few of these items, and you can see how dynamically all this information changes to your liking. So these are the things that I have just added there. And when I say apply, my screen reflects all this information right there now. One of the questions that Corinne asked was, can I have the schedule with multiple providers? So this is my home page. I have not gone to the schedule yet. But if I click on the filter here, I will be able to add multiple providers, visit types, locations, and all, and I will be able to see all of them on this home page as well. So for an administrator point of view, from an office manager point of view, you will be able to have those things and see who is doing what and all as such in the practice. Now, how did these appointments get here in the first place? The way I schedule an appointment, I just click on the appointments and say schedule. So here is my daily appointment scheduling window. When I hover my mouse on any patient, you can see the details of that patient coming up. The way I schedule an appointment, I just double click on a time slot that I want to schedule an appointment, and the dialog box pops up. Here again, I have the functionality to select the provider, location, and all, but the patient that is coming in, are they coming for an office visit or a follow-up or a consultation or a procedure? So depending upon the encounter type, which are all customizable, the appropriate duration that I typically assign for that will show up, which can be modified or changed as well. The name of the patient. Let's say the patient name starts with a letter, let's say H. I start typing it out. The names appear there along with the date of birth. So I could go and select the patient that manner. But if I need to search the patient with different criteria, I can click on this magnifying glass, search the patients with their first name, last name, sex, age, chart number, SSN number, phone number. So all these fields are also customizable based on how you would like to search your patients. These are all the patients in my system, so I can go and search on them. But if it's a new patient, I don't have to leave the screen. All I do is click on this button, add a patient, take the minimum detail that are required for me to schedule the appointment, take the appointment on them. I can also make any of those fields mandatory that are important from your practice point of view. Let's say the front desk typically forgets to put who is the referring provider, and you would like to have that to be mandatory. I can have that property set up that will show up with an asterisk over there so that the front desk has to select the referring provider before they save that patient. So you can force with certain functions that can be enabled in the system as well for information. Now, the other aspects is I can type the reason in the patient own words, or I can have my predefined list of reasons why typically the patients visit my practice. So if I say this patient is complaining about, let's say, low back pain, I start typing it out, it filters out, I could go and select that. I can also go and put my comments in. I can double book an appointment. I can put the patient in a wait list. I can also see if they have canceled, no-show, rescheduled. I can keep a track of that as well. Of course, on this patient, I don't have much, but it will typically give you the no-show and other aspects as well. Now, there are other things that come in play when the front desk is scheduling the appointment. For example, the patient says, I was asked to come back for a follow-up, and I can come only on a Thursday or a Friday. Tell me the first available appointment. So rather than searching on the calendar, what the staff could do, they can just click on this search button, apply the filters. The patient would like to come on a certain days of the week. They would like to come at a certain time, for which provider, for which location, earliest, next day, next week, next month. So based again on the filter that I apply and say fine, it will go and search the first available appointment that I can confirm with the patient and take that appointment. Now, when I say schedule, the appointment gets scheduled, and you can see the information showing up on the screen with the patient being highlighted and the information showing on the left-hand side. Same way, when I click on a patient's name, I see the information here, but when I click on this hyperlink, that takes me to the detailed demographic screen of the patient, where I can see their address, their contact details, other information that includes your language, ethnic group, race, and religion, which are important from the governmental meaningful use criteria, the other physicians in the area who work with this patient, along with the billing information, their 30, 69-day balances, with the patient's picture that you can capture through a webcam, digital camera, or even scan their ID in. You have this button for the patient portal. Through the portal, which again I'm going to demonstrate to you shortly, the patients can not only fill out all the required forms prior to coming to the office, they can sign their consent forms, they can check their lab results, they can request an appointment, check their statements online, pay the statements online. So there are quite a few functionalities, and we'll be covering that shortly. This button takes me to the insurance screen, where I could see the front and back of the insurance card that I have scanned in. I can also do the insurance eligibility check here in real time or in batch mode. I can also document prior authorizations over there for any procedures and all that have been document for which procedure code up to what date they are applicable, how many visits they have taken. So it will start counting down and also alert you if you take an appointment after the things have expired and all as such. Now, so I was showing you about the eligibility and all on here, but let's say that I am on this screen and I want to check the eligibility. I really don't have to go to the screen. All I could do is just highlight here and go over on these icons where I would be able to go. These are all the shortcuts there. I can click on this button, pull up the eligibility from which date I want to review. That will show up. Okay, this is, I need to see. I thought I ran for one of the patients there. Yeah, this is a different way that it is demonstrating, but I have a different way too. It actually gives you all the benefits information and all. This is my demo database, dummy patient, so naturally, it's not pulling up that information there, but it pulls out the information that it can, that the staff can review and all as such. Now, we scheduled the appointment on this patient. Okay, I know Corinne asked about some other information, so let me go back over there. So this was my daily view that I'm seeing right now. I also have a weekly view that I can see the week at a glance. I also have a multi-provider view. So when I click on the multi-provider view, I can see multiple providers side by side. Well, you can also customize your own views. Hey, you know what? One of this front desk person works only with the 3 providers. So I would like to create a view of my own where I would be able to go and add, let's say, add a new view. And I'll be able to go and create a new view for the providers that the person works with. So, and I can name that as a new view, and that will be available there, as simple as that. So in that fashion, I have a few views listed over there. So if I say show me a 7-doctor view or a few 2-doctor view, you can see all those things as such. And you can use any of these screens to schedule the appointments. You don't have to be only on a one screen. You can use any of those there. Now, when I go to my home page, we scheduled the appointment that you can see right there on Diana. And same way we have Deborah here in the scheduled status. Ideally, what we would want is that when an appointment is scheduled, we would like the patients to be able to complete all the required forms prior to coming to the office, going to the patient portal, and as I said, completing it there. In reality, what we also see is that some of them do, some of them don't. So personnel who don't, how do you address them when they walk into the office? So I'm going to demonstrate, like when you give them an iPad or a tablet or a touchscreen monitor, how are they going to complete that information in the office? So I'm going to pull out on the screen here. So when you give them an iPad or a tablet, this is the screen that they will see. Enter your first name, last name, date of birth. No passwords to remember right now. So I'm logging as a patient here. Basically, I'm checking myself in. So when I say submit, what it will do, it will check the patient in and it will give them the form that they need to fill out. So I would like the patients to be able to complete, let's say, a history form. I can have a history form for the patient to complete, and that will be available there. Of course, this is just a sample form. This will be replaced by exactly the way your form looks like with all the data elements that you can capture. So just for the sake of demo, I'm entering some information here, and you can see how that flows in. So we have like forms which can you do one click and all normal or abnormal kind of a scenario. This is just a form where I have to actually do more clicks there. But once the patient puts this information and says submit, that will be taken care and will show up in the EMR when the MA or the triage nurse is reviewing this information. We also would like to have the patient to, let's say, because the patient is complaining about back pain, we want them to complete this Australia Disability Index questionnaire. So that will be available there and the patient will be able to go and complete that. So bear with me, I'm not reading what I'm clicking on, but we will see how this transposes to the EMR when you're reviewing it with the score and everything as such. Now, the other thing that we would like to have the patients complete is the consent forms. So how can I have them? When I go to the legal documents area, I can see what forms I have to sign. So there's a HIPAA form that I have to sign. I'll be able to click on it, sign it, okay, and say submit. So any questions so far with respect to the intake process that takes care in the office?
I just had one question on the insurance. Once you scan the insurance card, does the information get automatically uploaded directly from the card into the EMR, or is it something that has to be put in manually?
There are both options. You can scan the information in, the image will be available there. You will have to look and type that in. Or if you say, I would like to have a OCR scanner set up, yes, when you scan that in, it can populate the respective fields over there. And even after that, you will have to check it. The OCR scanner that, the software that has to be installed, the companies now charge, I think additionally around $35 per device, I believe, that the scanning companies charge for that interface right now. So
Okay.
to answer your question, can that be done? Yes, but there is additional cost involved with that.
Okay, thank you.
Dr. Shockley, did you have any questions?
I don't think so.
Okay.
So those intake, so you can have any kind of forms, like you can have the patients do like the opioid risk tool, or you can have whatever type of questionnaire in the beginning.
Yes, sir.
Okay.
In fact, I think I may have the risk tool already available in one of the other databases. I will show that to you. But there are several, as I said, we work with a lot of pain clinics. So we have almost all different kind of forms that the pain clinic would need.
So like even your opioid agreement can be in the consent forms?
Yes, we can do that.
Okay.
Okay, so now let's go on to the patient portal, because when you register a patient with their email address, it's going to send them a login and a password. And when they log in for the first time, it will force them to change their password. So I'm logging as a patient right now. And based on the privileges that you give it to your patients, they will be able to do the respective information in the system there. So here I have given almost all the privileges to the patients there. So they are able to see when is the next appointment due. They can also see if there's a message that they have received from the clinic that they need to review. If there's any outstanding balances, they will be able to see that and look at the statement and make a payment from here. They can also look at their health reminders if there is any kind of, MRI to be done, or maybe a vaccination to be done, or any of those based on their the complications or the diagnosis they have. It can alert them in this area. They can also complete the forms that we were talking about, the patient forms. So, hey, there's a worker comp case. I want them to fill out a workers comp form, or maybe a, the pain management take form. So you'll be able to see that over there. Let me go and show it to you. So here you can see this is much more refined and tailored for pain, where it says, hey, where is the location, what is your complaint, and onset, and pain score. So you can have a form designed in this way that the patients can complete it, and it will automatically populate that in the system after you review after someone reviews in the EMR, on their chart. Then we also talked about the patients completing the consent forms, which again are made available right there that they can click on and sign, okay, and say submit. There are additional aspects that can be done that the patients have access to is My Health Record, where they will be able to see any education material that you're sharing with them. So we interface with National Library of Medicine, Medline Plus Connect, as well as Merrick's Manual. So when a patient clicks on the information, pulls up the data live from National Library of Medicine that they can review, print it at home if needed. This information is available both in English and Spanish. Now, coming to other information, let's say you shared some lab results or something like that. They can look at the lab results or look at the lab trends and click and even plot it on a graph. So those kind of functionalities are available too. Now, the other important aspect comes is the appointment part. Do you want your patients to be able to requesting an appointment from the portal? Some practices prefer that, some practices don't. So with whatever option you select, this can be enabled or disabled, and so is the prescription. So if you say that, hey, my patient should be able to request an appointment from the portal, and they can say which location, which provider, or you can say, hey, any provider, say find a time slot, that will go and provide them the time slot that they can click on. That will come as a tentative message for the practice personnel to review and confirm, and they may get a message back in their portal as well as an email that, hey, your appointment that you requested has been confirmed or not confirmed in that manner. Same way with the prescription renewal, they can go and select a prescription, send a request that will come as a secured message for the practice personnel to act on, send a message back on their message center, go and collect it from your pharmacy. Now, from the message center, we also have the option where patients can send non-emergency messages from the portal. So they can send the message with respect to however they are feeling and whatever feedback that you have asked them to send it, they can do that. We also give them the functionality where they can attach any pictures or documents and all to the portal, send that in a secured way rather than faxing you or emailing you or texting you. Then the clinic shared documents can be seen here. So, hey, you did a radiology and you wanted to share that report. They will be able to go click on that report, review that information, and print it at home rather than you sending by snail mail or handing over a piece of paper when they come to the office. The billing information here is more geared in terms of for them to look at their outstanding balances, make a payment of the outstanding balances, how they have made their payments, what modality they have made those payments. At the same time, they can also look at their statements, the one that was sent electronically, that they can review and download and print it at home. We also come across patients that are not computer savvy and who may need assistance. From that standpoint, you also have the functionality here where patients can be authorizing a user like their relatives or friends that can help them in the portal process and all as such. Any questions on this area before we jump back onto the EHR?
I had a question. Does it send appointment reminders to the patients?
Yes, you have the option to have the appointment reminder sent via text message or via email as well, both.
Is there an extra fee for text messages?
Yes, you can buy them in blocks of 500. As a part of our service offering, we give you the first 500 messages at no cost to you. After that, you can always opt for the higher bucket over there. Typically, it costs like around, I think, 6 cents a text or something like
Okay.
that. Email reminders are no charge. That are included as a part of the.
Does it have an automatic where it calls the patient automatically or no?
We interface with a few products in the market like CallPoint, PhoneTree, and all. So you need to sign up with them, and the schedule information can be sent through the interface to them for doing the physical phone calling. We don't have a dialer built into the system. No.
Okay.
Now let me log back into the EMR right now. So now when I log in, I can see here that the patient that self-checked themselves in, the status has changed to arrived. And also you can see the color of this icon changed from yellow to red. So yellow means that the patient did not fill out a form. Red means that the patient has filled out a form. And green means that the form that the patient filled was reviewed by the staff and has been populated in the chart. Now at this stage, typically what the front desk would do, they will go and collect their co-pays and all. So that can be done right from here or from the scheduling screen as well. So the front desk goes to the co-pay there. They will be able to see, oh, they have a $25 co-pay. Are they paying by cash or credit card? Generate a receipt and give the patient. Now, while I'm collecting the co-pay, let me go and show you the receipt. Because I said print, it is giving you a print overlay over there. So while I'm collecting the copay, I see there's a patient outstanding balance. I want the patient to pay that amount, and the patient may question about that balance, that they did not understand those charges or they never got a statement. So from that standpoint, we don't have to leave the screen, go to some other screen, pull that data. All the front has to do is click on that hyperlink that will go and pull up the statement that was sent to them last. They will be able to go and explain them the charges, try to collect the money while they're in the office. And it can be emailed or printed out and given to the patient, whichever way the statement has to be resent or something that can be done. Now, how do you start an encounter on a patient? All you do is click on the patient's name and you go to the face sheet of the patient. This face sheet that we call is divided into 9 different segments here, but that can be extended up to 16 segments, basically giving you all the information that you want to track on a patient when you open the chart. Now, this is all pre-populated because this is an established patient of mine, but if it's a new patient, all this would be blank, and what the staff would do, they will click on the patient form, review on what the patient has filled out. While discussing with them, we can even add, modify, change the data in that manner. Only when I say accept, it will go and populate the chart for me. And where is this information there? So when I go to my review of system, because that's what we filled, you can see all the things that we filled are available there now. I don't have to re-enter all that information anymore. If I have filled out any other information on that form, that would have shown. But if you remember, we also filled out another form, which was Auspicious Disability Index Questionnaire. So when I select that and say, I see, oh, they filled out all these things, which looks good. If while talking to them, I realize that they entered something wrong, I can even modify it. But now when I say, hey, calculate this total score and say accept. So when I go to my pain management section, I will be able to see all those parameters documented with the score over there. Now, coming back to the face sheet, there are multiple things that we do here. One of the important aspects is the current medication. The patient may sometimes tell you on the medication they are on, sometimes they may be forgetful and may not reveal that information, or they may be hiding from you. From that standpoint, when you click on the current medication, click on this med history button, it will go and pull out list of all the medication this patient has been on for the last 2 years with whichever pharmacy they have visited. So something that they forgot to tell you, hide from you, or don't remember, from this check that you do, or you're covered from your liability aspects and all as such. Now, the other thing is we also have the PDMP, or the prescription drug monitoring program with the state. We have the interface with that as well. Now, the other face sheet, hey, I would like to see when the patient comes in, I also want to look at.
Does it interface with the PDMP in Maryland, and what does it look like?
In my demo database, I don't have that enabled here, but yes, we do have the PDMP for the state of Maryland. It's taking a little longer here to pull up this information there. But typically it will pull up the previous chart information right there for you, also any procedures, and you can actually extend that to any of the tests or labs and all those things that you can see, which I'm going to show that to you in a different database because I think this one taking a little longer. Now, when I go to my document list, this is a central repository of every chart that I have on the patient in the system. So now I want to see the patient came in a couple of years ago on June 13th. What did I do on that day? I can just highlight, click on this button that will go pull up the chart on a new screen, or I can just highlight and say preview. That will split the screen into two. I can see the chart information on a split screen right. Same way, I would like to go and look at this procedure note that I did. So that will show up right there for you. Now, many a times in the practice, you also get this request from other entities that they would need the charts. The hospital wants a chart. The insurance company wants a chart. The provider that referred this patient to you wants a chart. So what you do, you make copies of those charts, mail it to them or fax it to them. Here, all you do is check the box of the chart that you plan to send to them. From a letter writing module with a covering letter, you can fax all the selected charts out of the system in one click. No more printouts are necessary. You can also send any of these charts to the secured email system to the SureScript network that we use. Now, we also have various portals. I already showed you the patient portal, but we also have a referring physician portal and employer portal. Employer portal is more for occupational medicine clinics, but the referring portal, physician portal may be relevant from you from a point that if you have a lot of referring physicians in the area, rather than sending them their consult notes and all through secured email or fax or whatever, you can give them the access to referring physician portal and they can review the information there. And let me refer, means the way it would be that you will highlight and click on the share button and you will be able to go and, say share on the referring physician portal and that will show up there. And it will be only the information that you are sharing and only for the specific patient that they referred to you, not for anyone else. Next in the process is the vitals here. We interface with the Welsh Allen's vitals equipment so that you can download the data electronically. You also have the history of the patient vitals that you can keep a track of. You can even plot or trend that information on a graph, so all those bells and whistles are available there. Now, many a time the providers ask me, some of these patients, we see them repeatedly again and again, sometimes weekly, monthly. So do I have to really enter all this data? Can't I just not bring the previous chart info, review that and make some changes and save that as a new visit? The answer is yes. We have a property in the system when we set it on. It automatically goes and pulls out the data from the prior visit that you can modify and save as a new encounter. We even go a step beyond that. When you click on this button that I'm pointing out to, the copy button, it will go pull out all the prior encounters. I can pick and choose from which visit I want to copy the data, and only for that specific screen I can copy it. I have copied the vitals information right now, which again typically you would not do because you will be entering that every time. Just for the sake of demo, I have done that. So I can go and modify that, save it, and go to my next step. So far, whatever we have done, all this is typically taken care by the triage nurse. At appropriate time, they hand over the patient to the provider for further evaluation. So how will they do that? They would click on this button here, say patient is ready for the doctor, in which room number. So on the doctor's home page, they will be able to go and see this is the patient now ready to be seen by them. You can also see the color of this icon change from red to green because we accepted the information that the patient filled out. So now when I click on the patient name, I can go and review if there were any changes on the face sheet. I did not enter any face sheet data. Otherwise, it will show in a green color whatever you have added today. Same way, when I go to my vitals, I can see what was copied, what was modified over there. When I go to my HPI, that gives me a list of all the complaints I see the patient for. Okay, this patient coming for back pain, I start typing, it filters out, I could go and select that. Now, the patients have a tendency to maximize their visit. Oh, by the way, doctor, my knee hurts. I want to add knee pain. So when I start typing knee, that would filter out. I will be able to go and select that and have a template for that too. So these are all my questions for back pain. These are all my questions for knee pain. So how do I complete my exam? I could customize my result area to the most default values. In that scenario, I can just do one click, select all the defaults, but I can then also go and modify, hey, this has been for 2 weeks or so. This is a intermittent pain that happens. This is because of a motor vehicle accident or injury at work, whatever the information could be. The pain is in the upper back, lower back, and spine. So some providers like to point and click. Some providers like to dictate. Some providers like to say, hey, I have my own macros. Can I use them? All those options are available there. So based on what I clicked on, my note is already ready and may show that to you. All I would do is click on this three-dot button and say progress note. It will open up a third panel, and based on the clicks I have done, the note is ready right there for you. Now, the other thing is, if I don't use point and click, or I have some options to do point and click, but I want to dictate my note, I can place my mouse here using Dragon Medical or M modal. I can start dictating. It will come beautifully well. If I say this area is too small, I can double click and have a larger area to dictate. Now, the other thing is, I may have my own macros or paragraph that I have stored for these kind of visits. So can I bring those over? The answer is yes. I can click on this magnifying glass there. It'll go and pull up the repository that I have stored. And when I hover my mouse on any of those, you can see what paragraphs I have stored. And I will be able to go and select, this is what I want to add, and anything else I want to further write or modify or change, I can do that. I click OK, save, and that will get appended to that area in terms of whatever I did through the clicks plus whatever I added as a paragraph. Now, same way when I go to my knee pain, I'll be able to go and select it. Well, this is only the left knee that is the problem, which happened for 4 days, and they have problem climbing stairs, bearing weight. Save, that will come up. You may also question, why are these options that are there? Maybe I want to add my own options. Can I do that? Answer is yes. So with respect to the list that is coming up, I can just double click on that element, go to my element level customization. I can add more to that list or remove it. I can change the way I would want to input my data. When I select that element in my exam, how the sentence should read on my progress note is what I'm defining it here. Again, you don't have to worry about these aspects, because when you sign up, we assign an implementation person to work with you. They will understand, we'll give you the repository of already all the pain content that we have, fine tune it to your liking, and then take you live. When I go to my review of any questions so far.
Did I miss, is there a way to dictate as well? I don't know if I missed that part, like
Yes,
like use Dragon or anything like that?
correct, sir. I did specify that. So all you can do is you can dictate directly, or you can have this area where you can, using Dragon Medical or M Modal, either of those programs, or any voice recognition system for that manner, you can use that. So this is a specific area only for HPI or history of present illness, but we also have a dictate and transcribe area which you can use. So let me show that to you. So you can, instead of going to the templates, you can come to this area and start dictating to the respective section role as such.
So you already have to have Dragon. So like, does Dragon Dictate already have to be installed on the computer or that you're using, or how does it integrate with the web software?
Yeah, basically what happens is, if you already have the Dragon installed, you may use the Dragon pad and have those and cut and paste it here, or you can place your mouse and start dictating it. It will come here as well. So, but Dragon, the only the way it works is with respect to the the note commands and all. But if you say, hey, go to HPI, go to review of systems, no, it is not integrated to that level. It is only integrated to the notes level where you dictate and have that information available. But you can use most of the Dragon functions in terms of go back, correct this, all those kind of things you can.
Oh, okay, I got you. Okay, that makes sense. Thank you.
So now, next part here is the physical exam, which again is because I selected back pain, it came up with the musculoskeletal exam as a default where I can select and put my findings and all. But now remember, we also said the patient has knee pain. I don't see the complaints for or the exam for knee pain because I have multiple templates that are available. If I go and pull up the lower extremity over there, I will be able to see the hip, knee, spine, foot, all those options there. I will be able to click on, complete my evaluation and all. But we also have the diagram where you have the human body, other parts of the body. All these icons that you're seeing are all customizable. I will be able to go and document the information in that manner. I can even annotate it. And this can be a part of your note. I can also, point out and enlarge any areas and document it as well. So based on where I click, what I do, I'll be able to document information from that standpoint. So this is something quite a few providers prefer to use, but we also have something called draw tool, and especially the pain doctors prefer, like that, where you will be able to click on the draw tool, it will pull up the diagram, and you can say, hey, this is the diagram I want to use, and I want to use a pencil or a pen, and with a specific thickness or a color there, and say, well, the pain starts from somewhere in this area there, and it goes in this fashion. And I also want to put my note in there. So I can put my information in that manner as well. And this can be a part of your note as well. Now, while I'm on this screen, let's say I want to go back to my physical exam, or maybe to my review of systems, or HPI, or any of those. While I'm here, I can just say physical exam, click, and the physical exam template that I was selected come up. I can complete my exam here, there. And same way, I want to go to my review of system, that will come up over there as such. So rather than going and back and forth, I can finish all that exam while I'm here as well. So there are multiple ways of doing it, multiple shortcuts are available and all as such. When I go to my pain management section, this is the most important aspect of your, I would say, if it's interventional pain practice, all those things that you do, all the specific templates are available there. This is my demo database. So I don't have very many, but let me go and pull out, let's say, the lumbar ESI. So when I select that, the appropriate content that I would like to select is available there. I say, yeah, this all looks good, but we did not work on L3, L4. We worked on L4, L5, and the kind of medication that we used was only 4 mg of Decadron. I select that. Rest of the things are good. I save it. My procedure note is ready exactly the way I dictate. Now you may say, well, this all looks good, but I would like to add something specifically for this patient. I will be able to go and place my mouse, dictate it, type it, write it, all those things I can do and save it as well. Any questions on this area, sir? Dr. Shockley?
I'm good. No, I don't think so.
Okay,
I'm good. No question.
thank you. So similarly, do you also do workers' comp and all as well, sir? PI and workers' comp?
Yes, we do.
Oh, okay. So yeah, for PI and workers' comp and all, I did not show that to you. Like you have different cases that you can manage under the specific patient, and the workers' comp form, the injury and the body areas and all that. You can document and it will automatically generate your workers' comp notes as well. So section, let's say I don't think I have the Maryland one. This is the New York one. Let me show that to you. When I go and select it, the form would come up. Of course, the information will be entered in this area. Once you say save, what it will do, it will generate your C4.2 for the New York one, the workers' comp form right there for you. Let me show the preview here. Taking a little longer. But what I also wanted to show you, what you talked about the pill count and other things, the opioid the scale and all. So let me actually log on to one of the other databases there and show that to you. So when I go to my pain management section here, so this is your risk assessment tool that you were talking about, risk factors, SOAP score, ORT score, and all those things that are there. And let me also show you some additional forms and all. Dosage calculator. And this is a different one there, but under the patient forms, we may have some additional, your COM questionnaire. And again, this is my demo database as well. It's a different database, but you can see all the aspects of, hey, when you're ordering a procedure and you want the patient to opt for that and sign and all those things, consent, these are the one that we talked about earlier as well. So, and when I go to the pain section here, if I want to say, well, I would like to see this lumbar facet medial branch block note, I can put my findings in, and there's my note ready with all the things that you want in detail, which are editable as well. So let me jump back onto the other sections there that I was wanting to show it to you. So we did not go over the procedure, the assessment and prescription and all. So when I go to my prescription, Here we interface with the first data bank drug database. So any drug that you name is available there. It also gives you all the pharmacies in your area. If you have documented the patient preferred pharmacy when registering it, it will show under the screen for you. However, when you click on this, you'll be able to select from close to 3,000 pages of pharmacies already listed in there, and you can filter by zip code or name or whichever way you would want. Now, give me a drug name that you want to prescribe. Anything that comes to your mind.
Any medication?
Yeah, any medication that you want to prescribe.
Just, I don't know, they could say Percocet 5325.
So when I start typing, it filters out. I could go and select that. I can see what all strength is available in the market, select the right strength for the dosage frequency and all. If I need to see what is this drug, I can click on this drug info button and see the information on the drug right on my fingertips. I can do the eligibility check, the formulary check. I can also do the electronic prescription authorization right from the screen. When I click on this update button, it goes and add to my current prescription that I plan to prescribe. I can also go and check their past medication history and re-prescribe the medications from this list here. I can also go and do the medical history reconciliation, the one I was showing it to you on the face sheet earlier, where you can do the PDMP as well as the their history coming out of SureScript, the 2-year one. You can do that from here as well. When I save it, it will also check for the interactions and also alert you. Now, I can send it electronically, I can fax it, print it, preview or print it, so all those options are available there. We also interface with a lot of labs, close to 140 labs in the market, LabCorp, Quest, CPL, BioReference, LabDAC, Spectrum, Genoptic, a bunch of them. Same way with some of the local radiologies as well. So when I click on this order sheet, based again on which lab I'm ordering to, I can go and select that. I will be able to go and select it individually or order it, or I can create my order set. Hey, when a patient comes for a certain problem, I can group those orders together and order that into as a panel as well. Same way with radiology, consults, procedures, and you'll be able to track those in terms of the information coming in, as well as know whether these were completed or not. So all those things can be done. I logged in as an admin, so otherwise I'm not seeing the bubbles over there. It will also tell you how many labs pending to be reviewed, how many radiology pending to be reviewed, and all as such. It also has a referral management system where you can look and add your referrals that you are receiving and the status of that, were they approved or not, all those things that you can, review that here. You also will be able to go and keep a track of the status of those referrals. So when I say referral tracking, and give me the status of all the referrals there, and say go, and let me select this quarter, or let's say this year, because this is a database. To be able to go and show the status on those referrals on the rejected or scheduled, or all those things as such. Now, what else was there? So yeah, once you are working on the patient, one of the things that when I was on the HPI, I was showing you the third panel here. So while I'm working on this patient, suddenly I remember, well, I forgot to review the information on this patient's, let's say, medication, correct? I want to see that. I can just click, rather than going to the face sheet, I'll be able to go and pull up the face sheet data here. I'll be able to go and review that information right. I want to go and review their past, scores or labs or anything like that. I'll be able to bring that up as such. Same way, let's say I want to look at the progress note in a full sheet rather than in this that is getting created. You see this expander there. I can just click on that and review the whole information there. There are quite a few things that we do, doctor. Anything that you have in mind that I have not covered so far?
No, I don't think so.
Okay. We also have the functionality where, for your staff, they can click on this resource center. It gives you the access to your videos, the documentation, the webinars. They are, professionally developed videos that are available for any new staff member joining in and, wanting to review on how to add a patient or a referral management or any of those things are available there. This is in addition to the training that we provide you one-on-one. Then there are several dashboards available for you to keep a track of, different aspects on the no-shows or canceled by patient, targeted, medications prescribed. So these are like, 9 segments I have put in. You can have the dashboard up to 9 different dashboards over there that you can track on. I know that Eric had asked about the reports about the encounter reports or tabular reports. There are quite a few reports that are available there. Let me go and pull up here. So there are different reports that are available there. So appointment needing referrals or appointment list or patients that were seen on a particular time. Different things can be pulled out from that. Same way, I have the report appointment report. I can pull that too. So let's see if I have. Yeah, today's appointment, no-show appointments. You can also filter the appointments by providers, different things that come in. So if I say for a doctor resource, different filters can apply and you can pull that report and all as such. Any questions? Eric, Corinne, Anand?
Nope.
I don't think I have any questions. This is Steve on the EHR. It seems like some of the others. Do you also have? Can it also be customizable for ASCs?
Yeah, it can be customizable for ASCs. We have pain practices with ASCs that use our software. So we have both scenarios where ASC and the clinic database are in one database. We also have clinics where for ASC they want to maintain a separate database where we can build a bridge so that whenever you are scheduling an appointment for a surgery, that information can be exported out of one database and go to the surgery database with the CCDA file so that you can import that and have that information ready when the patient is coming for surgery and all as such.
So would they have does it work even for Class C? Standalone ASCs? Let's say that we have Class A's for some of these locations, but others there's just a standalone Class C. Does this software customize? It doesn't have to be integrated. Can it be used for an ASC, or is it really not ASC specific?
So we have clients who have the pain clinic and have a standalone ASC that are using it. Now, I am not knowledgeable on Class A or Class C part. I will have to check with the implementation of the team and then get back to you in terms of the capabilities over there. But the software is extremely customizable.
Okay.
From a standpoint, if you say that, hey, these are the functions that I typically need, will you be able to do that or not? I can then probably educate you more on that. But I don't know the difference from that standpoint.
Okay.
Any additional questions? Anything else that needs to be covered? One of the things again is what happens to all your faxes that come to your office. So the faxes actually show up in this area and the staff will be able to see the fax and associate that to the patient's chart, see on which patient belongs to, select the patient name from there, put in the appropriate category. And when they say attach, that will move from there to that patient and the provider, the corresponding staff can get their message in their inbox that the new fax that has come that needs to be reviewed. Same way, anything that you scan in can also be attached to the patient's chart. So it goes to a centralized area and you can attach it. Or if you say, I would like to have a local scan attached where the scanner is connected to one of the computers and you go and select a patient, put the papers on the scanner and associate the category over there and scan, all those pages will go under that category on that patient for that date that you selected. And
is there a limit on the number of faxes? Do you have to have a separate fax server, or how does that work?
So you have both the options. You can have your own fax server that can be on the network and we can connect through that. Or we also offer the faxes through our server. So with the system, we give you 1,000 pages per month at no cost to you, but you have the option to select 3, 5,000, 10,000 pages, whatever you want. It basically comes out to be like 3 or 3.5 cents per page.
Okay.
So, Dr. Shockley, would you need any references and all for you to speak with and all in the Baltimore area? I can definitely send them to you.
Sure, you can send them.
But does it meet to your expectation what you're looking at, or am I way off than what you're looking at?
So I mean, so far, I mean, everything looks good. I mean, it's you know, I would probably need to play with it a little bit to really figure out like all the nuances. But I mean, it has all the features that are needed, of course.
Right.
So yeah, I mean, it looks fine. I mean, like, it's just really understanding and all the little details and all the little add-on features and stuff like that that are associated with the software.
Right. No, very true. And instead for you to play around with the system, we can arrange what you call another call, where I can give you the access. You can play around, and if you're stuck somewhere, I can guide you and all. So that will be more fruitful than you playing on your own and figuring it out. That may lead to a lot of frustration based on the experience that I have in the past. I'm just alerting you upfront, and I can make myself available and help you on that play around, if that, you know.
Okay.
Yeah.
Okay. All right. Sounds good.
Well, thank you all. I really appreciate your time. And just in case, if there's a question that comes to your mind and you need to, you know, call me, text me, let me leave my cell phone number with you. I'm in Austin, Texas, Central Time Zone. And my number is 512-426-2538.
Sure. Thank you.
Yeah. Thank you all. We look forward to
Okay, thank you, Ramesh. I'll circle back to you. Thank you very much for the time.
Yeah, thank you.
Yeah, it was great.
Yeah.
Be great.
All right.